phased approach. So the governor is working with the Oregon Health Authority, her medical advisory panel, to create guidelines for individuals. So practicing good hygiene, keep washing your hands, strongly consider the wide use of face coverings in public, staying home if sick. These are drafts that continue to be discussed. We're also looking at broad guidelines for employers regardless of sector. So these could look like developing and implementing appropriate policies such as social distancing, protective equipment, sanitation, temperature checks, monitoring the workforce for indicative systems, and again, contact tracing policies for positives. So these are all drafts that are still being discussed with a variety of stakeholders. When we look at individuals and employers, there would still be broad recommendations recommending that vulnerable individuals continue to shelter in place. Remaining individuals, when in public, should maximize physical distance, avoid social distancing in groups of 10 or more people, closing common areas where people are likely to congregate and interact, minimizing non-essential travel, and continuing telework. You'll note this number 10 is still being reviewed by the Health Authority and Governor's Medical Advisory Panel. So again, this is all a draft and is continuing to change as we talk with more and more groups of people. So you'll see here the federal government proposed how we could be looking at specific types of employers. So at the top you see schools and organized youth activities. So the federal government has proposed that those remain closed in phase 1. You'll note on the right in red that Oregon is considering childcare as part of reopening in phase 1. And so that's why we're talking with you all today, to kind of get your feedback on what guidance would need to look like to be able to do that. As I mentioned before, there's geographical considerations if we take a regional approach. So we'd be looking at declining growth in symptoms and cases, regional testing capacity, regional hospital capacity, regional contact tracing capacity, and regions would be working with the Oregon Health Authority on plans for readiness. This is sort of a background piece that's being discussed. So an additional prerequisite that's being considered would be a formal request to the governor from CEOs and CMOs of local hospitals within the county committing to daily PPE reporting to OHA, PPE supply chain reliability, and hospital bed surge capacity. It could also require a recommendation letter from the county public health officer, as well as a vote of the county governing body certifying sufficient PPE for first responders. This is all draft, and this is more, I know it doesn't necessarily affect you all, but this would be kind of another back end piece before anything actually reopens. Once we get through phase 1 in a region, we would be waiting 14 days. If we pass the gating criteria, again, looking at symptoms, cases, hospitals, we would then move into the next phase. So this could look like increasing gatherings to 50, resuming non-essential travel, schools and gyms opening under physical distancing. If we're able to wait 14 days again in that region without seeing a spike and we pass those gating criteria, we would look at phase 3, which could see another increase in mass gathering sizes, unrestricted staffing at work sites, returning visitors to nursing homes, and restaurants and bars having more seating. So again, that's far off, and we're really just focused on phase 1 right now. So this high-level framework I'm walking you through has been making the rounds for the last 2.5 weeks or so. The Governor's Economic Advisory Council is a critical piece of this as well, as we know the economic toll that this has taken on a variety of sectors and businesses. And so we continue to add to this list. The 6 sectors that have been identified as being eligible for phase 1, again, a regional basis is restaurants and food service, retail, personal services, including hair salons, massage parlors, tattoo parlors, childcare, transit, and outdoor recreation. So these next steps continue to be a moving target, but we began these presentations about 2 weeks ago and have been consulting with the affected industries. Our goal is to have complete details of the framework by next week and finalize discrete steps in a step-by-step reopening plan next week or the week after. And this is all, of course, in ongoing coordination with the West Coast states. There are some reopening resources that I'm happy to share with you all, and then I'm going to run through this appendix super quick so we can just focus on the public health guidance. So these are the gating criteria. Again, there's some draft timelines that continue to change as we work on the state's responsibility for ensuring we're meeting the core preparedness and gating criteria necessary to be able to start rolling this out. I will note that added component here, the governor has, consistently has made equity her platform and is very concerned with creating systems for our hardest hit and most vulnerable populations. So that is an added element that will be included in the final framework. Quickly too, the federal definition of vulnerable individuals largely remains the same: elderly individuals and those with serious underlying health conditions. So this is a very broad public health guidance for childcare. And some of you might have seen some draft guidance that's in more detail floating around. It's a draft. But so broadly speaking, we're looking at several things, limiting the number of children in facilities and in rooms. There's been a recommendation to cohort children by age group, as well as cohorting specific staff with groups of children in rooms and avoiding crossover between groups and rooms. There's also considerations of having staff wear cloth face coverings. And Miriam and Amy, I'll invite you to jump in here. In the discussions we've had and the feedback we've received so far, cohorting children by age group is not a common practice in childcare, and we were able to work with the health authority that would not be a need if we are able to cohort specific staff with groups. I'll also note that the health authority recognizes that maintaining physical distancing is not practicable in most childcare settings, and so this cohorting model would be sort of the best defense with mitigating the spread of the virus within a larger facility. With that, Miriam or Amy, I invite you to jump in with kind of additional details you want to provide and some considerations, and then want to leave space for questions.
Thank you, Alyssa. This is Miriam. I think the only thing that I will add is that number of the cleaning and sanitation practices that Early Learning Division and the Oregon Health Authority have put out as guidance at this time, as well as what we're calling COVID-19 safety practices, which are, which is guidance around screening all staff and children as they're coming into the center, limiting. So there's a lot more detail. I don't want to suggest this is the only kind of health guidance. Yep. So I think some of the source documents right now, specifically the COVID-19 safety requirements, and then sanitation and cleaning practices. We are also in the conversations we've been having around additional public health guidance for childcare in phase 1, I think will likely to continue to be required.
Mm-hmm. Amy, is there anything you'd like to add from the licensing perspective?
No, I think Miriam really covered the fleshing that out a little bit. Yeah.
Great. So I will put up some questions the health authority is interested in. I know that you all have questions as well. Want to give a couple minutes if folks would like to kind of weigh in on some thoughts here and what additional information you'd need, and then happy to kind of turn to the questions you all have as well. And Beth, if it's easier, I don't know if it's better to kind of turn to the chat and run through those first.
We did have several questions kind of come up as you were just going through in the chat. And so one of the questions around cohorting by age groups and what would that look like for siblings? And then I think to follow that up, John asked, about people that might register for certain days of the week. And because in childcare, that's a very common practicality, right? That they may do a Tuesday, Thursday, and Monday, Wednesday, Friday. And does that work into your phase 1, or is that something that you're considering as a later rollout?
Yep. I'm happy to start that, and then of course Amy or Miriam jump in. So we've been working with the health authority, and we will likely not be moving forward in an age group cohort. We know that with siblings, but even just as we think about our smaller childcare homes, that's just not feasible to be able to cohort by age group. So we are focusing instead on making sure we're kind of working through the kinks of what cohorting groups would be, including how do we ensure that if there's floating staff, how do we make sure folks are getting breaks, and that if there's additional cleaning practices, face covering requirements, if we have someone moving between classrooms to relieve staff. There's the sanitization protocols Miriam mentioned about shared spaces for eating and shared restrooms as well. But Amy or Miriam, anything you want to say on the kind of days of the week question?
Yeah, I can take a stab at this. Is Miriam. We have been working with the Oregon Health Authority to develop some guidance around that. We've been, I think it's really, we've been talking to them about respite care, but I think it's also kind of very applicable in, what does it look like to maintain kind of a stable group for certain kind of days of the week. I'll say some of the things that I think keep coming up with respect to those conversations, and would love to hear others' ideas kind of around this, and what they think we should be kind of talking further with the Oregon Health Authority around, have been really making sure that there's, again, going back to the cleaning and sanitizing procedures, like sort of in between cohorts and different groups. Again, the kind of the stable groups, I think is also something that's coming up quite a bit, and I think would probably need to also see kind of an adherence to smaller group sizes, and then really adequate kind of daily log, really great tracking of, of adults and groups of children sort of across days, and in the event, that as we move into, as Alyssa talked about, in reopening Oregon, more capacity around testing and contact tracing if there's a confirmed case. I think a number of those practices I can imagine being part of, non-full-time care or respite care kind of arrangements, part-time care.
Yeah, I would just echo what Miriam said. This is very much a health authority discussion, and you've framed it in terms of the days of the week, a Monday, Wednesday, and a Tuesday, Thursday split. Another version of that, like I think Miriam indicated, is like an AM PM split, and I think we're still working through the various health implications for that, for spread of the virus and the contact tracing if something were to happen. So we're still, I think, working through that.
Mm-hmm.
And there's been several questions that have come up in the chat box, but I think we'll go back to some of the categories of questions that we were thinking to address in the call. So revisiting kind of the reopening, there were questions around, does this include residential? Where do kind of some of the licensed exempt fall in that phase one? Do summer camps count within phase one? So there were some questions around that. Do you have thoughts on not knowing exactly when all, but?
I'm happy to start on the summer camp question. So the trickiest part of summer camps, obviously, is that they're only in the summer. And we know that summer is very, very quickly approaching. So the Oregon Health Authority, I believe, is working on guidelines specific to summer programming. And that would look like recreational outdoor-based camps, along with summer school and other kind of mixed setting summer programs. That is being vetted among senior health advisors. So I haven't seen it. No one in our office has seen it. And there will definitely be really specific engagement on the summer portion. The hardest part with this is we know that anyone operating a summer program really needs to know kind of now about whether they'll be able to operate and how they'll be able to operate. Are there going to be group limitations? What are the sanitization protocols? The tricky thing is when you remember that we're talking about reopening the state in phases, and we're reopening the state possibly county by county. Some counties may get the notice they need to begin operating and may be able to operate all summer. Other counties may not know that they're reopening until the middle of the summer. So I know I spoke with Beth. I know she's been giving advice, sort of try to plan on a week by week front, so that you can easily kind of make adjustments. But I think the really tricky part is there's some parts of the state that probably won't get to have summer programming because they're not even in phase 1 yet. That being said, we are considering summer programs for children to be kind of within this child care catchment, but they would have additional guidelines based on these, but with additional kind of considerations given the different settings they're in. It's just, I don't know how quickly that's going to get out, and I don't think every county is going to be able to utilize them because they won't be open yet. Sorry. And then Miriam, do you want to talk, or Amy, about the license exempt piece right now?
Sorry, I was muted. I noticed too that there was a question in the chat was related, which is recorded school age programs sort of considered childcare? And so, Amy, I don't know if you want to start and just maybe describing the emergent, that we are the emergency childcare regulatory framework that we're operating under right now. How
right. Yeah, so recorded programs have been under the executive order and the ELD temporary order implementing that. Recorded programs have been required to be applying to be emergency childcare, just as the licensed childcare programs have. And so that's the sort of state of the state for recorded programs at this time. So that's what's necessary, which is out of the ordinary, but is of course out of the ordinary times.
Yeah. And I'll say license exempt programs. So programs, is a big category of programs. Some, and I would say, and we don't always have kind of shared meaning around it. When it's used, because it is such a big category. I would say in this context, thinking about providers, caregivers who are caring for 3 or fewer children, they are not right now impacted by, they were not required to submit an emergency child care application. We know a number of them are continuing to provide care. Some of them are regulated by the OCC if they participate and serve families that are enrolled in employment-related daycare, but not all family, friend, and neighbor, providers are. So that's, I think, kind of one group that, but at the same time, we recognize, we want to provide support to family, friend, and neighbor caregivers. We want them to have resources. We've been, at least the ones that we know about or in touch with at the state, because they serve families who are participating in ERDC. We're trying to include in our efforts to get supplies to. We would want to give training around COVID-19 safety practices, et cetera, as we look to ramp up those efforts across the state to be able to support all providers that are operating and caring for children. I think the other group that comes to mind is, license exempt programs based on whether they're a public entity, so our schools and others. And in that framework, anybody that is operating childcare right now, what the governor's authority, executive order, and then ELD's authority under the governor's executive order is to be able to ensure that anybody that's operating and taking care of children is subject to and following these public health requirements around cleaning and sanitation, stable groups, a lot of the things that Alyssa covered in her presentation. So I think, as Amy noted, that's why recorded programs are impacted. That's why a school that's operating emergency childcare that is typically license exempt is impacted. Like anybody that's providing emergency childcare under this regulatory framework is having to follow and adhere to these public health guidelines as they are now and as they will evolve, I think, as the state reopens regionally.
And yet there's the schools basically will stop as of June 30th. That
Yes.
was a temporary order?
Right. So what happened in so schools, I think, and Alyssa can say more about this, but schools that under normal circumstances did not operate childcare and opened up childcare in response to the governor's directive to provide childcare to the children of essential workers, again, focusing on school age care. Those are phasing out and will close at the end of their school year, some of them probably likely before June 30th. But there are also schools that normally provide childcare. I'm sure you're familiar with many of them, or have childcare programs in their facilities. And they are all, whether they're operating childcare with a partner or they are operating childcare directly under normal circumstances, they will also have to adhere to the same requirements that licensed providers or recorded programs are with respect to the public health guidelines.
And we had just a couple questions pop up, I'm hoping quickly, around is it possible to apply now for license exempt, and kind of what is the time frame on emergency childcare applications at this point?
Amy or Ian, I'll kick that to you.
Yeah. So so you can we can still process a emergency childcare application. For Miriam, can you help me with, for a license exempt, like a park and rec? So I'm trying to keep this straight in my head. I apologize, everybody. But so certainly they need to follow the public health guidelines that are out there, and the requirements is, I'm trying to think through, Miriam, have we landed on whether they need to apply for ECC approval, or
Yeah.
I'm blanking on this at the moment. I apologize, guys.
No worries. So yeah, they we are still accepting emergency childcare applications, I think, for licensed programs and recorded programs. So if you were license exempt because of hours of the day and not because you were a public entity, for example, and you were required to be recorded, you would need to provide submit an emergency childcare application if you wanted to open that site. I think one of the areas where this gets a little tricky is that at the onset of the emergency, especially when schools were closed, there was a concern, and the demand among families and the need for childcare was very, very difficult to estimate. Is even though there was a lot of efforts of working with employers to survey the children of essential workers. One of the flexibilities, in this regulatory framework of emergency care, a flexibility that OCC provided was for an experienced provider, so say a recorded program or a licensed provider, or even some experienced providers that provided childcare or other kind of supports for school-age children, could almost got like an express lane and an expedited process to open up in a facility that is not usually their facility, and so that it will not be allowed unless there is a demonstrated need. So I guess I would say, if you are, typically operating in a community-based location and you were closed and you would like to open again as an emergency childcare provider, and you were a recorded program, that is still possible to do. But if you were, hoping to, applying to be able to provide emergency childcare in a location, say a law firm, we got that request early on, like can a law firm, has a space and we want to provide childcare and we'd like to bring in an experienced provider, you would have to go through the normal licensing process. And also meet the emergency childcare requirements or the normal sort of recorded program sort of process, and also meet these emergency requirements. Did that help, or did that confuse people more. It's kind of confusing still. So I would just say some of this really requires case by case, and I think Amy's team is doing a really terrific job of being able to kind of field questions and work with individuals to kind of understand this framework as we expect. There's going to be more interest in opening. I will say there is a lot of vacancy right now among providers that are open. We have about 2,000 providers to date that are providing emergency childcare, and I think we continue to hear from them that they are, they can care up to 10 children in a stable group per home or sort of per classroom, and many of them continue to report to us they are not full. To date, our data indicates from this week we have about 8,000 vacancies across those 2,000 emergency childcare.
Amy, can you clarify real quick? And then Lindsay Capps, our Senior Education Policy Advisor to the Governor, is on, and I want to tap him on some of the school-based questions. Amy, if you're a recorded program or a licensed program, you're still able to apply to be an emergency child care provider, right? You don't have to just be licensed.
That's correct. Well, so yeah, this is where we get into the nuance. So for licensed, yes. And if you want to operate, so we had licensed providers tell us they wanted to shut down for a while and then reopen. Yes, you can do that as a license. You need to stay closed until you get your application approved. Recorded becomes challenging because some recorded programs just want to continue operating as a recorded program. And for folks I saw in here, some people are like, what's a recorded program? Frequently recorded programs are like, they do a couple of hours of like after school stuff, and they're not childcare per se, but they have some function of childcare. So they go through a different process called recording rather than full licensure. So that's recorded. But other recorded programs sort of expanded during this emergency time to perform sort of full-blown childcare. So that's not something that a recorded program can do going forward. We've limited this. They were loosely referred to as the pop-ups. You would have to demonstrate a real need, capacity need in your geographic area and demonstrate that to be able to do that. For a true recorded program, I think we're gonna have to work through how that works so that, those couple of hours a day, sort of things, we're going to need to work through how that continues to work when you're not trying to perform full-blown childcare.
Thanks, Amy. So really the emergency childcare application is directed towards licensed programs that have been closed. Great, thank you. And then Lindsay, I wanted to turn to you on some of the school-based questions, not just for emergency childcare, but some of those programs that are located on school sites.
Yeah, hi everybody. It's great to join everyone as we're all working together to find ways of ensuring access to these really critical programs to our children and youth. The one just overarching statement that I would make to help folks as we're working across various settings for childcare and youth programs is that currently speaking, the Department of Education is authorized, as schools are prohibited from providing in-person instruction or small group instruction during the effective period of this emergency order, which is for now through June 30th. OD is authorized to make some exceptions for school districts for summer learning opportunities, and other extended learning opportunities. And Beth and all of us have had the chance to talk a little bit about this as it pertains to the governor's executive order. At the moment, we do not have any authorization from the Oregon Health Authority to provide any programming within public schools settings. So within a public school facility or on the grounds of a public school facility. So that's a process that ODE is working through now to determine what is the appropriate social distancing protocols that could be applied that would allow that to be authorized. So that's forthcoming. And today's discussion is helpful in that, by the way. The second thing is the way that executive order has been set up means that ODE also has to authorize that. So as you're thinking about summer programming, that to this point is not provided for through school facilities, given OHA's findings to date. Once we have clear guidance on that, it will be working with your school district to get necessary authorization from the Department of Education. So I just want to put that out so that everyone has that general understanding. I don't want to confuse that with the phasing process that Alyssa went through. I just want to be really clear that that will be the process going forward under the emergency order.
So let me try to clarify. So that means that, let's say I live in Lincoln County and the school district, I normally have had a process with the school district and I want to open my program in a school building. First the school district, then the Department of Ed, then, so is that the process? Or should it be a process?
Yes. Now, ideally, that's a great example, Beth, and thank you for putting that in just real concrete, practical terms.
That's
That is the process to date. Now, there could be subsequent guidance from the department that says, under these circumstances, just generally, youth programs can operate in this manner, and we won't have to have that process necessarily. But for now, my best advice would be to work with your school district and to have those plans sort of put together, and then for there to be consultation and then authorization from ODE.
Okay. And will there be a designated person at ODE?
I think we'll have more information on that, but that would be my understanding, that they would have a designated point of contact.
Okay, that'd be great.
And then just to follow up in the chat box from Chuck over in Florence at Boys and Girls Club, if they're not able to use district buildings where they would normally host things, if there's not other spaces for them to use, that would certainly be an issue. And so I guess the question to some of those counties that might be reaching phase 1 before others, will there possibly be a process that would allow use of buildings before June 30th, I think?
That's a great question. And what I would say is kind of aligned to what we just talked about. Regardless of phasing, ODE is authorized under the executive order to authorize some small group instruction. So whether or not a county is gone through that phasing process, there's still flexibility for ODE to make those determinations independent of that process. So I guess in other words, that flexibility already exists. We just aren't at a point yet in which the Oregon Health Authority is authorizing any groups of students coming together within a public school facility, but we're working through that. And again, today's conversation is helping us provide good feedback for what that could look like.
Yeah, it looks like we're generating more questions than we're helping people get answers. Go ahead, Bethany.
I was going to say thank you. And we do have several more slides on some specific questions that came up before, particularly around summer and some things that have come up out here. As you mentioned, Alyssa, in your start, like we don't know exactly what that'll be in the timeline on phasing. People are wanting to start as soon as possible in planning. Will summer camps, when they come out, will that include residential, overnight camps as well as day camps, is something that had come up. And is there going to be limitations on time as well as space, was something that some partners were asking around.
Yeah, so again, I know the Health Authority is working on this, but none of us have seen the guidance yet. So while I imagine that there will be space considerations and group size considerations, I don't know that for sure, and I don't know what they are. I would also imagine that residential programs are being considered, and it's something that I can flag for the health authority to make sure it's on their radar, but I don't have any sense if it's going to be included in this guidance, or if it's just going to be focused on sort of the day camp space of summer programming. I know that's not helpful.
It's helpful that you said you'll make sure it's flagged somewhere. So that's good to know. There were specific questions around PPE accessibility as people try and get ready, and some guidance on distancing measures, and if that will come out as well in, you mentioned the summer specific that's being worked on.
Yeah, so far, if we look at childcare, for example, there's some guidance that's being considered around cloth masks, right? And so suggesting that providers wear cloth masks, but so far it's not a requirement. And we know, particularly for younger children, there's some social emotional implications. It's just kind of scary to talk to people in masks. That being said, there have not been PPE level recommendations, so that's sort of like a medical grade level of recommendations. We are hearing this concern from restaurants, retailers, other sectors as well. So our office is working on trying to identify resources in terms of who would be kind of eligible partners to helping these businesses kind of procure those. At this time, there aren't funding resources that would be available to provide these to businesses or programs. But so far, like I said, cloth masks, gloves for cleaning, but cloth masks have really been the furthest that we've gone down the PPE road, at least with childcare in mind.
And I'll just note the couple of questions that came up that I'm hoping might be quick references. So one from Boys and Girls Club around doing some small groups for online schooling. And I don't know where that falls in the opening up category. Yes, no, or in what phase?
Yeah, so, and Lindsay, feel free to jump in with the kind of digital equity piece. So far, unless a Boys and Girls Club is registered as an emergency child care provider already, they are closed. So right now, there would not be allowability to allow small groups of children in to their computer rooms, but it is something that we can take back to the health authority and kind of talk through, and in conjunction with sort of that, the caveat Lindsay provided around small group learning in school settings. So I think that can be a gray area. So we'll follow up with the health authority on that and where that would fall.
This is Miriam. I think we are also working with the health authority around, Head Starts, but given federal resources to be able to provide services as well over the summer and summer school. So we've also heard about the need for respite care. So I think there may be a lot of parallels around the guidance we get from the Oregon Health Authority around, the practices that ensure safety in kind of small group settings. But again, I think this call has been helpful for Amy and I to hear that within how the regulatory framework may need to be more specific about how and when such programs could operate if they've typically been required to be recorded.
Mm-hmm. And I think too, there's the recognition that school age programs don't necessarily fit into the 0 to 5 process and some of those things. So some considerations and discussions around that would be really helpful. And, I know there are people that are still at early learning division that have done quite a bit of work on that area.
Yes, absolutely. And I will just say that, and, Alyssa and Lindsay may have more to say here, that, the group size, and stable group size requirements and stuff is something that, is not, obviously, as I think everybody knows here, not just, kind of specific to childcare or a within just childcare conversation, whether it's birth to 5 or school age care. The considerations there, I think, are really important as they emerge. One is the fact that while, social distancing, maintaining some physical distance may be a little, it's like easier as the children get older, that, it is really challenging to do. And so that's sort of one piece, just in providing kind of care in general. I think the second is the understanding about, the bigger group size requirements across the board. So if restaurants are not going to be able to have groups of, 10 people come together that normally don't reside together, or public schools are not, childcare, whether it's a few days a week or a few hours a day, or 10 hours a day, every day, are all going to need to be kind of aligned.
Mm-hmm. So a good opportunity for alignment.
Right.
Yeah, be good. The other thing that maybe you could sort of think about this or put it on your radar, Lindsay, is the migrant education piece, because we have 28 migrant sites that operate primarily in public schools, and for those kids, it's critically important that they continue their education in the summer.
Mm-hmm. Yeah, Beth, I can respond quickly to that. And I do think, just to be really clear about the relationship between we're kind of having two conversations today as it relates to K-12. So the reopening conversation really applies to returning to normal life that we all have experienced in the education world. Schools are open, childcare facilities are open, and we're kind of back to a normalcy to the greatest extent possible. And the other conversation we're having is, how does the Department of Education begin to provide specific and on a limited basis in-person instruction or interactions with students? Mm-hmm. So I want to be really clear about that, because there's actually more flexibility for that second conversation now than is required in terms of this reopening discussion. So I just want to hope folks are getting that distinction, because this can be a little confusing and laying all this out at the same time.
Right.
So to your point, Beth, about migrant education, I think the department would look at any population of students that are better served in an in-person context as being a priority for purposes of applying flexibility. So as an example, right now, the department is working with the Oregon Health Authority around providing not only educational but nutritional services to youth who are in youth detention and youth corrections facilities, so that services can get to those youth. So that process is very contextualized to those facilities. By the same token, as we look at migrant education, as we look at students with disabilities, as we look at students, frankly, seniors in high school who might need to do credit recovery through summer programming, or for other summer programming that helps us bridge the divide in terms of summer learning loss. Mm-hmm. Those are all areas the department is looking at right now to figure out how we could help facilitate that kind of in-person learning. So that doesn't require a reopening process to necessarily happen. It just requires us to be able to put the parameters in place around social distancing that allows for that type of programming. And many of the programs that I'm sure are represented on this Zoom meeting today to go forward. So I would encourage, and we will have follow-up with the Oregon Department of Education in particular about some convening around that specific guidance. Mm-hmm. And again, as I said earlier, in the absence of that guidance, working with your school district, if you are using a school facility or school grounds for any reason, to have conversations about how could your summer programming or after school programs or extended learning programs be facilitated. And then the department can work with you and the district to figure out how that might happen. So I hope this is a really difficult time for all of us, and I understand the urgency of these conversations. So I'm hoping that's providing some level of clarity, but a lot of work is underway to try to respond to the needs here.
Mm-hmm. Well, and it's our hope that we'll be able to continue these conversations and help facilitate information going out in a consistent way, both from early learning and from the Department of Education.
Yeah, very well said, Beth. Thank you. Yeah.
So I did just want to take note, there were several comments and here's in the chat box for questions around funding and the need to support, particularly when these ratios are very different from normal capacity and programs aren't able to operate at full capacity, whether or not they're getting funded or getting people to pay for programming. So just a quick, any thoughts on these questions about gear or ERDC and funding in particular that might be accessible?
Yeah, I'm happy to start with that. So the Oregon received $38 million through the CARES Act and the Childcare Development Block Grant, specifically to respond to emergency childcare needs. So I know Miriam put this in the chat, but there's $8 million that's been designated to go out to emergency childcare programs that have been operating, and were operational in before this. Before COVID, there are remaining funds, and you know, the goal is for us to sustain as many programs as possible, so that when things get back to normal or closer to normal, we have enough childcare for everybody to return to work and for kids to be in healthy, safe, quality environments. So we are definitely looking at the CARES Act funds with that lens. The GEAR funds, and Lindsay, feel free to jump in here, can be used for a pretty broad set of purposes. So we are working to take a P20 lens to these funds. Our community colleges are taking a huge hit. We know that there's broadband limitations and other considerations for our K-12 children, and then of course supports for childcare and school-age programming. So want to acknowledge that we know the 10 group size limit is not sustainable, financially viable for your program, and that we're looking to utilize as many of our federal funds to support programs as possible. I also want to just note too, you know, it's no surprise to anybody that we know the economy has been struggling, and so I think I just want to acknowledge the limitation we have as a state to use our existing budgets to be able to support these programs. But we know this isn't sustainable, so we're working to support you all as best we can moving forward.
Thank you. We are just nearing our 3 o'clock hour. So for everyone that's on, thank you so much for joining, and we'll keep this going for a few more minutes so you can put in the chat box what questions we may not have gotten a chance to get to, and we'll make sure that we kind of send those along, collated into some specific questions that might be helpful as they're getting all of this put together for recommendations.
Thank you all.
And if you have, we do have a survey that we've been doing, and we're putting together a small report sort of on, and we'll use the conversations that we've had and the questions, and hand it to Alyssa and the governor's office and to Miriam and anyone who's interested in looking at it, about the situation for school-age programs, both licensed and exempt. You know, you serve thousands and thousands of kids in Oregon, and you play such critical roles in return to work. So we're really, whatever we can do to help facilitate the opening of programs and supports for families, we're here. And I want to shout out to, wow, some of the programs, like I know Salem Boys and Girls Club, you've been doing food. I saw things across the state where school age programs are really making a huge difference in food delivery and supports to families.
Yeah, thank you.
So Meg
Okay.
is on from Farm Workers Housing.
And yes, we will. I just want to say we did record most of this and we'll share this out along with comments and questions that came through and try and respond to questions around where to get the best up-to-date resources and information. I know there will be new information coming out early next week as well. We'll make sure that you all have as much information as possible.
Yeah, and we have one of our staff people who's been every day, all day long, following COVID and all of the information from OHA and child nutrition. And so she is 3, maybe 6 weeks now. So everything COVID, Cassie Rossell in our office is our go-to person.
Thank you everyone for having me. I have to jump off, but I so appreciate the feedback and the questions. And Bethany and Beth, any resources you need, and then yeah, happy to look through those questions and provide as many answers as we can.
Okay, well, we appreciate your time. Thank you, Miriam and Alyssa and Lindsay and everyone who joined us.
Thank you.
Thank you.